Hi, Kevin Henry, the editor of Dental Assisting Digest, here today at in New Orleans at the ADIA meeting, and I'm talking to my good friend Jane Weiner, RDH, about documentation and record keeping, and she just put on a real good talk about that. What are some of the high points from your talk that you'd like to share with the audience about that?
Some of the things that came up yesterday when I spoke were on the topic of what needs to be in the documentation. And of course, I said quality is more important than quantity.
Okay.
But they need to make sure they've documented everything.
Okay.
And they need to be sure that if radiographs are taken, that what was found on the radiographs is documented.
Gotcha.
And they need to be sure that risks and benefits are both explained to the patient when treatment plans are presented. So when the OM comes into play,
Yeah.
this OM needs to be sure that that's been done, because many times the office manager is the one who's going to present that treatment plan to the patient and sit with them.
And do you find that sometimes there's a gap in communication between the back office and the front office when it comes to this?
Frequently there is, but if they're all on the same page and they communicate with one another, then that's stopped and prevented, and it is preventable. And that's what I tried to explain to them yesterday, that I have the utmost respect for dental assistants, because in my opinion, dentists are the openers and closers.
Sure.
And the assistant today, a certified assistant, does the work. I have the respect for the office manager, because if a presentation of a case isn't presented properly, the patient's going to walk.
Right. Very
And
true.
if they present it properly, it's accepted. So now the hygienist, who I respect.
Of course, absolutely.
Their job has become easier, because in their assessment of everything, they can explain to the patient what is needed, but the finishers are right behind them, and they have to work as a team.
Nice. And, you and I think, would agree that the team members are really the backbone of the practice, and it's really the backbone of this
Absolutely.
process as well, right?
Absolutely. If they don't work as a team, and I referred to the prima donna, and I said, I've never been a prima donna hygienist. I don't believe in working with prima donnas, whether it's hygienists, office managers, or assistants, or dentists.
Mhm.
They've got to communicate, and they have to be on the same page. And then with the record keeping itself, I was trying to point some of the pitfalls that would keep them out of the Board of Dentistry meetings as disciplinees.
Okay.
And some of those things are no spaces between treatment. If I've treated the patient and then the dentist is treating the patient, there should not be a space, even if it's electronic. Anyone that treats the patient should sign the chart with their initials today.
Okay.
So if I'm sharing that treatment with the assistant, which frequently is done today, the assistant must initial that chart as well.
Ah, good point.
And the other thing was, if you make a mistake, it's okay. It's not okay to extract the wrong tooth.
Right. Yeah,
But
that's an
if
issue.
it happens and a line is drawn through that statement, that's what's important.
Okay.
If it's a mistake in charting or in documentation. But if the mistake happened, document it. It's okay to admit the mistake was made, but be sure that then the patient is informed
Yeah.
and the risks and benefits are explained to the patient. And this is where the whole team has to work together.
Always better to admit it than ignore it, right?
Absolutely, you have to admit it.
Okay. All right, Jane, I appreciate the time.
Thank you.
Thanks.